Hi, and welcome to the SaVeg podcast. I'm Rose, and I'm a content creator going by the handle Cheap Lazy Vegan, and I also own a vegan cafe by the same name as the podcast, which is SaVeg Cafe.
And I'm Daniel, also a vegan, and one of your favorite guest stars on Cheap Lazy Vegan's YouTube channel.
We're two friends currently living in different countries, and we'll be giving our savage take on all things life, veganism, and the latest trending topics.
So basically, whatever comes to our minds, because we love to talk.
You are currently listening to the previous episode of this podcast, but if you would like to listen to this week's episode and get some exclusive content, go over to patreon.com/thesavagepodcast.
Hey guys, just wanted to let you know that we actually recorded this episode a few days ago. So many of the situations and things regarding the coronavirus have changed, and including many of our opinions on what's going on. It seems like every day, almost every hour, there's new information or more information that changes kind of what's our outlook and what's going on with the situation. So please take everything that we say in this episode with a tiny grain of salt. And if we do say something that seems a little bit unsensitive, please recognize that we are taking this very, very seriously, and even more seriously as the days go on. Please, as recommended, stay in and practice social distancing as much as you can, and listen to the current recommendations from your government, your health professionals, and other qualified individuals. That being said, we hope you enjoy the podcast.
Hello, everybody. It's Rose.
And Daniel. Hey, guys.
And we are doing an extra episode this week because of all the crazy things that have been happening in this world. And we just had to come on here and chat.
Yeah, no, definitely. I mean, it's just... obviously, if you don't know what's going on, where have you been? There's a
Living
global
in a box.
pandemic. So we thought it would be good to kind of timely and also just kind of discuss what's going on and, chat with you guys about it because it's pretty crazy.
It's absolute insanity. First of all, Daniel, would you like to tell us what's happening over there?
Oh,
personally,
God, yeah.
And also in Spain?
Okay, so I'll give you my personal situation at the moment because I feel like this whole corona thing, like I heard about it, and then the funny thing is, hang on, I'm just going to take this little, there we go. Feels much better.
Okay.
So I heard about the whole thing and we kind of knew about it, but it felt like it went from like 0 to 100 in terms of panic over like 2 days. So basically I had been at school this week. On the Wednesday, everything was fine. Everyone was kind of mentioning it. Then Thursday I came into the school and literally the teachers were freaking out. It was like all of a sudden everyone went from like, being a little bit scared to being absolutely petrified. And the teachers were like, oh, there's something that they're not telling us. Like, they think this virus is a lot worse than what, is being released to the media and blah, 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 blah. And I was like, okay, calm down, guys. Like, they're getting very, very intense about it. And then I get home and all of a sudden I get an email from the company that I'm working for through the government. And they were just like, basically, your schools are canceled for the next 2 weeks. So they're completely shut down. The teachers still have to go in, apparently, just the teachers, but the kids and no one else is going. And I was like, okay, this is weird. And then I went to the grocery store and oh my God, people are freaking crazy. Like literally the toilet roll's all gone. First of all, there's no toilet roll in all of the city, probably.
Yeah.
And then like all of the food, all of the produce section, I've never seen, like the produce section was completely empty. Where they keep, like everything was like, there was so many empty shelves. It was crazy. It was like
it's insane.
Armageddon or something. I don't even know what was going on. Yeah. So, and I just feel like the thing is, obviously it is still like a bit scary, but I think the more people like start getting panicked, the more that causes other people to panic. And it causes this like chain reaction of like people getting super, super angsty and panicky about it instead of kind of trying to handle it with a little bit of like, I don't know, what's it called? Not tact, but like being a bit more rational and trying to like,
Yeah.
I don't know.
It's exactly. I think first of all, the toilet paper thing, I will never understand. It never made sense to me because this is not a zombie apocalypse, people. It is something that you might need to be quarantined for. The fact that everyone is hoarding toilet, like how much toilet paper can you go through in 2 weeks? Not a lot.
I was just thinking that.
I'm sorry, what are you eating? And it just shows how like all of this hoarding is showing how selfish everyone is, you know? It's like, leave some things for other people. Like, you do not need 4 bags of, like, you know, 20 rolls of toilet paper. I'm sorry, but no one needs that. And if you are in that much trouble, toilet paper is the last thing you're probably going to being worried about. Sorry, I just woke up. I'm like, I can't talk yet.
No worries. But no, exactly. The whole toilet paper thing also is like, has me baffled, because at the end of the day, like, if I was in a dire situation, I'm in my house, what are the main things that you need to live? You need food and you need water, right? And like,
exactly.
At the end of the day, if I'm like, having some serious bathroom issues, you can always just hop in the shower and, clean yourself off that way. You know what I mean? Like, it's not a necessity to have freaking toilet paper. Like, so I just don't get it. And you're right. It causes an unnecessary problem for other people, because then it's like, oh, I need to get this toilet paper, but now I can't because, 4 other families have hoarded like more toilet paper than they'll need for 2 years. So like, it's crazy. It's just crazy. And then
it started with that. So it started with the first initial annoying people that bought too much toilet paper, and then people started panicking about lack of toilet paper. Exactly. So then people are going out and buying toilet paper because they don't know when they're going to get toilet paper. Exactly. And then the same goes with like food and buying way too much food. People are just filling up carts of food that they don't even need. Exactly. And it's crazy.
It goes back to my whole point, though. It's like, I understand, obviously, we're facing, like, the World Health Organization has said this is a global pandemic, everything else. And it's not a great situation, obviously. But at the same time, I feel like the way that people handle it can be, can actually improve the situation. And by hoarding toilet paper, by hoarding supplies, by like every man for themselves, getting all crazy, that's like the worst thing to do in a situation like this. And actually, it creates unnecessary problems for other people. And then, like you said, and it catapults the problem in a sense. Like, for example, I might not hoard toilet paper, but let's say I actually needed toilet paper and I went there and all the stores are running out, then I'm going to start panicking and being like, oh my God, I need to get toilet paper. And then it creates this like vicious cycle of things that didn't need to happen to begin with. If everyone just bought the normal amount of toilet paper, they would be fine.
I know. And it's so now also, this is crazy. Oh, and also I know you said like it went from 0 to 100. I think also, I also felt like that. I mean, I don't think I felt it to that extreme yet, but it's starting to happen. And the reason why I think is because, oh, by the way, guys, so today is the 13th. So this is March 13th, because a lot of what we're going to talk about is going to be out of date in like 3 days, probably. Exactly. It's Friday the 13th as well. Great. Fantastic. Hope you're doing well. Yeah. Praying for you. But it's because the announcement made by Trump, which happened, I think, the day before yesterday, I think. And so he made the like announcement that he's going to ban all travel from Europe for 30 days. And I think this caused a huge surge of panic, but also what's happening in Italy has caused a lot of panic, because they've just announced that over 1,000 people have now died from coronavirus, which is giant, because they are not even the most heavily affected. But also we don't know these numbers, because Italy has not been checking. We don't know how many people in Italy actually have it. My guess is that like a ton more people have it than is being reported.
Because if you look at like the stats in China and stuff, it shows like, and we'll go through that in a minute because I have some of them with me, but like, well, I've looked up some stuff, but like it shows that there was a lot lower of a mortality rate than what they're experiencing in Italy. And in China, there's a lot more reported cases. I mean, this is another thing too. Now I'm creating my own panic because I woke up this morning and I have a little bit of like a congestion. God. And now I'm just like, oh my God, what if it's corona? You know what I mean? Like it's causing this unnecessary like...
Okay, just putting this out there. Well, first of all, I'm not saying people shouldn't be worried and concerned, because obviously I think the biggest concern is that this thing is spreading without people realizing. I think that is the biggest thing, because again, for people like you and me who are healthy, knock on wood, we are most likely going to be fine. We might struggle a little bit, but we're most likely going to be fine because we are young and healthy. But the problem is us going out into the public and potentially spreading it to people that might not be fine.
And infecting other people.
So that's the concern. But for yourself, all you have to do is like stay in, and hopefully you have lots of cans of beans available and enough toilet paper to last you 2 weeks.
Yeah. Well, that's basically the situation that's happened here, because now I don't have school for the next 2 weeks because that's all been canceled. And I did have a few trips planned. I was supposed to go to Granada for a weekend. That's been canceled. And I was also supposed to go to London for a weekend. That's also been canceled. So
Right. So I think Europe is freaking out because of what's happening in Italy. And I think you paused for a second. So yeah, I think the reason why people are freaking out, especially in Europe, is because I feel like Italy did not handle the situation very well. And at first, I think maybe, again, I don't know the actual facts. Please fact check everything, by the way. And please, again, I heard that there's a lot of like fake information going around. So please be careful as to where you're getting information, especially when it comes to how to handle this situation, because obviously you want to trust, the sources that are coming in.
Exactly.
But yeah, because there's so much that happened in Italy, and I think a lot of people in Italy maybe were nonchalant about it at first, and this caused a lot of stir and a lot of spread that was not necessary. So now everyone's like, okay, actually, we need to stop this spread now.
Oh God, it's so scary. I mean, not scary, but like,
it is kind of scary.
Yeah, it's a bit scary, and it just shows you. I think this is just highlights how. Not fragile, but just how easily, like if there was to be, and I'm not saying coronavirus is going to be the one that's going to be this crazy, because obviously like overall, like we said, it doesn't have the highest mortality rate. Like I think overall it's like 2% of people that get it. It's still pretty high, but like, 2% versus imagine if it was some kind of apocalyptic, virus that killed like 50% of people that got it and it spread. And this just shows you how fast a virus can spread globally and how literally every single touch of the world is impacted. Like every single corner is impacted. Yeah. So that's kind of
and
scary.
how fragile we are as a species.
Exactly.
In a world.
One big like, not to be kind of like a Debbie Downer or whatever, but like, one really scary virus that has a, really high mortality rate, like the Black Plague or something, could wipe out the entire world, like it's crazy.
I know. It's insane. Well, oh God damn, you be starting the day off with a scare tactic, huh? I'm just kidding.
No, we're not trying to scare anyone. And like, I think Rose, you kind of said it really, really well. It's like really, there is a lot of like, because even when I was doing some research for this podcast to look for numbers and everything, there's so much information out there. So I think it's just like, you need to be mindful of where you're getting this information and like, check your sources and where the information is coming from.
It's not something to be taken lightly, of course, because already thousands of people have died and it is a serious situation. Yeah. And because we don't have a vaccine for it yet, it's even more scary.
Exactly.
So it's not something to be taken lightly, but at the same time, I think what I'm concerned with is the effect of all of this crazy commotion and the panic and the lockdowns, what's happening. It's bringing out the worst in a lot of people. People are being racist, and not anymore now because now Europeans have it. Okay, so probably less racism toward fucking Asians. It's bringing out people's racist colors. Great. It's also bringing out people's crazy selfishness of going into a supermarket and buying the entire aisle of things when they don't even need it. And then it's probably going to bring up more things. It's probably going to up the crime rates. Who the fuck knows? And it's going to shut down businesses. Our economy is going to be impacted, just globally speaking. It's crazy.
Well, they do say, there were comments and like some articles and stuff that were saying, the coronavirus, because like already, like I know like globally we were kind of like, a lot of, especially the Western economies and stuff, there has been a kind of global economic slowdown to some degree. And they were saying that the coronavirus has kind of like, it's almost like it's going to catapult that. So it could slip us into a global recession where, all countries will be impacted. I mean, it makes sense if we're doing like, lockdowns of countries, no flights, all of this stuff. It's like so many people and businesses are going to get impacted. And that's kind of like scary what the impact after that's going to be.
Yeah.
So
it's really scary. I think the economy, that's like, because the world runs on, money. Exactly. What are we going to do, man?
Exactly. I mean, in some ways, I don't know. It's just, it's
like, I'm not concerned for me per se. I mean, of course I do have my small business, my cafe, which I am a bit concerned about. I wasn't concerned until yesterday when this whole thing started to like really, when shit hit the fan, basically.
Yeah. What's it been like in Calgary, Rose?
Well, okay, to be fair, again, until a couple days ago or yesterday even, it felt normal to some extent. Yeah. Of course, it's all everyone could talk about. the coronavirus. It was a big topic of discussion. But as far as I could see, businesses were still running, and number wise, I don't think we've had a huge number. We're still like technically low risk, but I think because of the Trump announcing the thing, and the last couple of days being so crazy, people are starting to freak out more. I know that like my roommate, for example, she works at a big firm, and a lot of they're freaking out. They're sending out a lot of emails with like precautions, telling people to work from home, and just all kinds of crazy stuff. So I haven't personally yet felt like it has changed a lot, but I think that's going to start changing in the next few days. Yeah. So I feel like our cafe is probably going to be impacted. Less people are probably going to come in. Like I can just feel it. Yeah. I'll notice like when I went to other cafes, it seemed slower. Like there's a very busy cafe here. That's not mine, a different cafe. And that cafe always has like tons of people. There's like never space to sit. And when I went last time, like a few days ago, it was kind of empty.
Oh, that's weird.
And they weren't giving out any more like to stay cups. Like they were only using portable cups, to-go cups.
To prevent like people having like cross-contamination or anything like that.
I guess so, yeah.
Yeah. It's pretty...
I don't know.
It's pretty scary. God damn. And I do feel like again, we've mentioned this already, but it sucks that these kind of incidents, they bring out the worst in people. And again, like, all this like hoarding behavior and all this stuff, I just think like it's so bad. You know what I mean?
know. We need to stick together,
Exactly. We need to stick together and like, help each other out. And like, if you're feeling sick, you keep yourself at home. But again, like if you're in isolation for 14 days, I mean, realistically, how many rolls of toilet paper are you going to use? So
honestly, I feel like I've had toilet paper underneath, like one package of toilet paper underneath my sink for like a very long time. So people need to stop freaking out. Anyways,
exactly.
Yeah, let's talk about some of the other things okay, what else have you found, Daniel?
Well, I went onto a really good website to look at, I think, is the World Health Organization. So I went on there and I looked at, they have like a whole like Q&A section on coronavirus, which there was some really, really interesting stats and figures. So globally, as of, I believe it was March 7th, we passed 100,000 individuals that were contaminated with the disease, the virus, sorry. It was 101,927. And then if you exclude China from that number, it was like, so China made up the main proportion of that. It was like about 80,000 cases in China and then 20,000 in the rest of the world.
Right.
Mm-hmm. But it is
That was
spreading.
the most recent number?
Yeah, that's the one I could find.
Because yesterday I thought I saw that it was 130,000 people that were infected, but you said a little over 100,000?
100,000. No, that was as of March. Sorry, that was as of March 8th.
God damn, Daniels, that ain't up to date.
Oh, God damn, Moses.
Okay, let me find it. Okay, so I guess you don't want to look at random numbers, but I don't know if this number is to be trusted.
Exactly, but that's the thing. That's why I wanted to go with the World Health.
But this looks like it's a trustworthy source.
Okay.
Worldometers.info. Maybe not.
Okay.
But I do feel like it's a lot higher than 100,000. But I mean, I don't know why World Health Organization. Okay, let's see. Look. World Health Organization rolling updates on coronavirus disease. So, come on, World Health Organization, can you do a better job at this reporting? Because this is pretty crap.
Give us an update, Roses.
Okay, well, this is from worldometers.info.
Yeah.
And it says, it's the number one thing that pops up when I Google it. So I don't know. Again, I don't know the accuracy, but it does say 139,000 coronavirus
75.
cases.
Yeah.
Yes. And then deaths are 5,117. And then 70,729 people have recovered. Okay, so that's good news. But the 5,000 number is pretty high of deaths. And it looks like so it looks like total deaths, the highest number of deaths is in China, 3,177. And then the second highest is
Italy.
Is Italy, unfortunately, at 1,016, which is crazy because total cases, it says total cases in Italy is only 15,113. So out of that number, 1,000 people have died. But once again, it's probably a lot higher than we
Exactly. Well,
can
like you were
imagine.
saying, and we kind of mentioned this in the last podcast when we talked about Korea and how Korea did like the
Yes.
drive-through testing. So I'm thinking if other countries are a little bit like lax or not as efficient with the testing, it is going to come up that there's less people that have the disease or the virus, and so the stats, there's going to be underreporting of the figures because that seems really high. The fact that, what is that, 1 out of 15 people in Italy that get the disease die. So that seems like crazy, whereas you look at China and
It's crazy.
like 3 out of 80.
But
So-
apparently even young people are dying. Like it's pretty insane what's happening right now over there. But also, so I was reading yesterday about why the numbers in Italy are so crazy.
Yeah.
So a few things to note is that apparently Italy has a higher population of elderly.
I was going to say that makes sense.
Yeah. So that's a big factor. And also apparently they have a high rate of people that smoke. So they have again, these are not the only factors, but I think that's kind of the guess as to why it is such a big, death rate. But who knows?
I would also think that maybe, well, actually, no, that wouldn't make sense. And I was thinking Italy compared to China. But I guess, yeah, like in Italy, people do smoke a lot. But then I think in China, people smoke a lot. But in China,
people smoke a lot as well.
Yeah. So I don't know. And also, there's a lot of elderly in China, too. So.
Sorry, guys. I had to go and take a shit. So.
The professionalism I deal with on this podcast.
It's early in the morning. I'm drinking my coffee,
Yeah. It be, but see the interesting thing. Okay, well these stats are from China, so Italy might be like an outlier with regards to this. But like, again, this is March 8th data, so I'm a little bit out of date. But it was saying like the fatality rates for like our age group where we are is like 0.09%.
So like for which age group? Below 50?
I was looking at 20 to 29, Rose. I forgot how old we were.
Goddamn, Daniel, you think you're still in your 20s.
Some days I do. No, sorry. So for 30 to 39, it said the mortality rate, and again, this is only based on the data from China, was 0.18%. So not even like 1% at all. It's like below.
Wow, it is very low. Okay.
Yeah, but then once you get to the higher ages, this is when it gets really scary because, once you hit 50 to 59, that's like 1.3. But when it really gets scary is over 70. So 70 to 79.
What's 60 to 69?
4.6%.
Okay. Yeah.
70 to 79 is 9.8%. And 80 plus is 18%. So it is a lot less for the seasonal flu versus the coronavirus. So for all ages for the coronavirus, so we look at all the stats. And again, this is based on Chinese data, I believe.
What website are you looking at?
So I can send you the link.
Just tell me the website.
It's called
so people know.
Vox.com.
I don't know if we trust Vox, but okay, continue.
No, but they have all of their sources. So I feel like it's legit. And a lot of their sources are from the World Health Organization. So, I mean, sure. I want to kind of take it.
Give me the numbers.
Yeah. But anyway, again, but you're right. No, Rose has a really good point. Again, question the data. Like, you never know where this is coming from. I mean, it does say it's from the World Health Organization, so I'd hope it would be accurate. So it said the mortality rate for the seasonal flu for all age categories is 0.1%. And the mortality rate for the coronavirus for all age categories is 2.3%. So 12 to 24 times higher than the flu.
Again, we have not tested everybody.
Exactly.
So these rates are hard to measure for both flu and corona.
Exactly.
We don't actually know the real numbers.
Exactly.
It could even be lower for flu because I don't know, like how do we base this on? If I have the flu, I don't go to the doctor.
Well, this is it. Like I think it's
So it could be lower for the flu. Do we have the numbers divided by age group? For the flu?
For the flu, let's see what it has on this. It gives it...
Because I would like to know.
Okay, but the age categories are really like crazy. But they have a comparison. So it's 0 to 17 years for the flu, 0.004% versus the corona. But this is why... these stats are ridiculous. So they compare 0 to 17 and then the corona is 0 to 19 years. So again, the data is like a bit skewed. So
Why are they dumb? Okay,
I
continue.
think they're dumb. So then it says it's 0.1% for the coronavirus, and then 18 to 49 years for the flu is 0.02% versus 0.3% for the coronavirus.
Okay, interesting.
But again,
interesting.
for that age category, up until you get to about 50, and obviously I think, it's not super high. I mean, it's scary. It's still scary, but I think, like you said, I think the precautions that we need to take as young people, or youngish now that we're in our 30s, is that like if we do feel symptoms and stuff, then we need to be responsible and, you know, for example, not be visiting our parents or our grandparents, or, you know what I mean? That's when we need to take steps to be like, actually, you know I'll be fine with this. Well, hopefully, knock on wood, that I'll be fine with this if I get it.
Yeah.
But be kind of mindful of the people that you're around, and especially for older people and probably like really young kids as well. I would imagine like infants and stuff, it wouldn't be like a, you know.
Oh God, infants, it's scary, man.
Yeah.
I feel like if you get it as an infant, I heard it could cause problems for your respiratory system, because like your body is not developed yet when you're an infant.
Exactly.
So God, if like, it's just it's just so scary. I would like to ask, what are the numbers in Spain? Do you know?
I don't actually
Since you're
know.
in Spain, let me see.
I should know this. I know that everyone's...
Let me look at the worldwide numbers.
Okay.
Once again.
Are you going back to that?
Yes.
Okay.
Worldometer.
Oh, here we go. I'm on it already. So we have Spain.
Okay.
So apparently in Spain, so Spain is the 5th most infected country. So it goes...
Oh.
Yeah, China, Italy, Iran, South Korea, and then Spain. And Spain has 4,209 cases, and it's had 120 deaths.
Wow.
Mm-hmm.
Oh God.
Yeah. So
what is happening? I feel like what do you call it? Again, we don't know. Oh God. Yeah. Some countries, okay, to be fair, like USA, 1,832 cases. Don't know if I believe it.
yeah.
They don't. Okay, USA. Okay. Oh, let's talk about the USA now. So once again, this brings up the conversation of private healthcare versus, you know, a public healthcare system. So USA, a lot of people probably are not tested or are not going to go get tested because they don't have money to pay to get tested.
And even if they get symptoms, they're not going to go to the hospital because it's going to be expensive. So like they're going to be like, you know what, I'm going to ride this out at my house because I don't have however much money it costs to go to a hospital in the US. So
yeah,
I mean, that's sad on already so many levels, but then also it's going to impact the reporting and the stats that are coming back globally. So yeah, I don't know.
So we don't know these numbers in the US. I have no idea what the numbers are in the US. It's probably much higher than we know. Yeah, it's crazy. But one thing that I would like to discuss is Korea, and I thought this was kind of cool.
Yeah.
And because like obviously we've had a lot of infections in Korea, because I think we discussed this in the last episode, but mainly because there was this cult-like church.
Yeah.
Where it got like basically thousands of people got infected in that church. And then this is how it all started spreading in Korea. And that's how Korea started getting some of the largest numbers in the world.
Yeah.
However, what's interesting is the reason why Korea, so despite the number of people that have the coronavirus, the cases of deaths are very low in South Korea.
Yeah.
So can you read me the numbers of South Korea right now?
Let's see. We'll go back to that lovely website. Okay. So South Korea, its number is 7,979. Does that sound right?
Yeah, that's the number of people that have it.
Total cases.
Yeah, sounds correct.
And then the total number of deaths in South Korea was 71.
Right. So pretty low compared to, for example, Italy that has just a little bit more in terms of cases, right?
Yeah.
But a lot more
deaths.
deaths.
If you look at Italy, I'll just give it like, cause Italy has, let's just round the numbers. Italy has about 15,000 cases and Korea has about 7,900. So we'll say 8,000. So Italy has almost double the number of cases than Korea, but it has like so many more deaths because South Korea has 71 deaths. And if you double that, you're at 140 and Italy has 1,000 deaths.
That's insane. Is is it a problem with the healthcare system? Like, I am honestly a bit baffled, to be honest.
I don't know.
Because
I think that's why what has kind of catapulted the what am I trying to say? The panic, because, you know, obviously we look at China, we look at Korea.
Yeah.
Death rates were manageable, I guess, there, or not. I say manageable. That sounds really bad, but they weren't as prolific. And then you look at Italy, and you're like, oh my God, look how many people are dying there. Then people start to get that panic. Like, why is that going on?
Especially because you're in Spain. You're in Spain, so you're very close to Italy, so you're probably freaking out even more.
Exactly. And apparently Spain is up there as like the 5th number country or something like this with cases.
Yeah. I don't know. But anyway, so South Korea. So this article I have up now, it's called How This South Korean Company Created Coronavirus Test Kits in 3 Weeks.
Oh, wow.
Crazy. So apparently this company, I'll read the article in a bit, but basically this company started creating these kits before it even became a big thing.
Yeah.
So as soon as like the kind of news hit, so before we started all freaking out, they started creating these test kits. And I think this is how they are able to test so many people.
Yeah.
And how they've kind of gotten this under control. So I feel like this could be a good model for other countries, but it's going to be hard because the technology is not there.
Yeah.
So basically, let me read this. Before there were any cases of the coronavirus confirmed in South Korea, one of the country's biotech firms had begun preparing to make testing kits to identify the disease. On January 16th, the chief executive and the founder of molecular biotech company SaVeg told his team it was time to start focusing on coronavirus. This is before the virus sweeping China had been named COVID-19 and 4 days ahead of South Korea confirming its first case. Blah, 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 blah. Fast forward 2 months and South Korea is among the world's most infected countries with more than 7,800 people infected and more than 60 deaths. But one reason why South Korea might have a higher number of infections than other countries is the aggressive approach to testing. So again, I think we've tested over like 100,000. To date, the country has tested more than 230,000 people.
Yeah.
Compare that to the US, which I think the numbers are like nothing.
Yeah. But it just goes to show you again, and we talked about this before with the whole hoarding and all this stuff, there's negative ways and there's positive ways that we can approach this. Do you know what I mean?
Yes.
And if we do measures like that company in Korea where they're like, actually, let's be a bit proactive with this. Let's get testing kits out. Let's make this manageable. Let's not create widespread panic. Let's get this under control and not create people running to the grocery stores, hoarding shit and freaking each other out and, you know, this mass chaos. There's a much better way to manage it versus, you know, what does happen seem to be happening in other countries, which is just crazy.
Oh God, this is insane.
I know.
I'm just hoping. Yeah.
I was gonna say,
Sorry,
like,
continue.
no, I was gonna say, like, have we? I don't think I've ever experienced anything like this in my life. Like, have you? Like, I don't think we have we?
That's the thing. I was thinking about this the other day, and I was thinking, this is the craziest kind of, you know, global lockdown, global panic I think I've ever seen in our lifetimes.
Yeah.
Maybe when the only thing I could compare this to, like, correct me if I'm wrong, but like I remember when 9/11 happened, there was, you know, some panic about flying. I remember like not many people wanted to fly into the US or whatever. There was a bit of panic about that. SARS, I don't remember, like I do remember people talking about it and I do remember it being a thing, but it didn't feel very close to home.
Yeah. No, I agree.
But again, we were younger.
Exactly. That's the thing though. The same thing though. But I think even if we were younger, like the thing is like, for example,
it wasn't this crazy.
Exactly. Like look at in Spain. I don't know what's going to happen in Canada, but like in Spain, they've canceled all of the schools and universities for 2 weeks. So like,
oh my, everything for 2 weeks.
All schools, universities, high schools, colleges, all canceled for 2 weeks. The kids are all sent home. Like we would remember that if we were growing up. Do you know what I mean? If we had like a school-wide thing shut down for 2 weeks. I mean, it's you know, and I can see like they're trying to take precautions and stuff like to mitigate people being in, you know, these very social situations with lots of people because that's where it spreads. Right?
Yeah.
So.
Yeah.
Oh, it's just.
I know it's absolutely crazy. It's a bit devastating, and you know, some people are concerned that the similar thing that's happening in Italy could happen in Europe. I think that's why people are concerned. Yeah. Because there's so many uncertainties around this whole thing, and because like, you know, so much has happened in Italy. Yeah. You know, people are thinking this could happen, you know, in other countries.
Exactly.
It's crazy. So let me just read you. So I have this article by Al Jazeera that is kind of comparing how Italy and South Korea handle things differently. Okay. And So it says, it's quite interesting. Both countries saw their first cases of the disease in late January. South Korea has since reported nearly 8,000 confirmed cases after testing more than 222,000 people.
Yeah.
In contrast, Italy has more than 12,000 confirmed cases after carrying out more than 73,000 tests on an unspecified number of people. Okay. And it is impossible to compare the numbers directly, but some say the different outcomes point to an important insight. Aggressive and sustained testing is a powerful tool for fighting the virus. Okay. So that's the thing. Number one thing is testing is very important, blah, blah, blah.
Which would make sense because
similarity.
I was going to say it would make sense. Sorry to cut you off really quickly, but it would make sense.
No, that's fine.
That aggressive testing would be like that because, like, for example, if they just did like a mass testing, like, and we found out that we had the coronavirus, then okay, we know that we have to stay indoors, we have to seclude ourselves, blah, 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 blah.
Exactly.
And we're not going to infect further people. Versus if you don't do that, people are walking around with the coronavirus and they don't necessarily know and they're impacting other people. So that makes sense. Sorry, continue.
Yeah. No, it's totally fine. I mean, it's a long article, but basically it's just kind of like talking about, you know, how South Korea handled it differently. Yeah. South Korea has a slightly smaller population than Italy at about 50 million people, has around 29,000 people in self-quarantine, which is crazy because I think right now in Italy, everyone is in quarantine. Yeah. Everyone is under lockdown. I don't know what is happening. It's breaking my heart. Italy, you know, I have a soft spot for Italy because I used to live there. Yeah. And I'm hearing from people that live there and everyone's just kind of, you know, it's just not in a good situation. And plus, for the whole country to be under lockdown in a country that's already, you know, economically, it's, you know, suffering a little bit, a lot of people. Yeah. It's sad. Yeah. I don't know. I don't know what else to say.
Well, they were saying, and I can't remember if it was like somebody on Instagram or somebody posted, like it wasn't necessarily like a reliable source or whatever it was, but it makes sense. They were saying that, you know, this coronavirus is going to have some serious impacts on people economically, especially those that are, you know, already struggling. So imagine, you know, you work paycheck to paycheck, working at like I don't know, some kind of cash in hand job or whatever it is. And they're closed for 2 weeks and you can't work there. And your landlord comes, rent still due, everything else. You know, it's going to really, really impact those people. So it's scary.
Yeah, like what's going to happen? What's going to happen? Because I feel like also, I don't know. Okay, it's probably the Italian healthcare system was not prepared for this. Yeah. I think I was jokingly talking about this before, but now I like don't even feel comfortable joking about it. But basically, I do remember when I lived in Italy, I did feel, again, this is just my personal experience, but I did feel like the bureaucracy was a bit of a mess. Yeah. Like it just felt kind of like a bit of a mess. Like anytime I wanted to like get anything done, I had to like go doing all kinds of crazy shit just to get one little thing done.
It's like that in Spain. Yes. They're like a big fan of, first of all, paperwork. Everything's done by paper still. Like literally, to do the simplest things, anything that you need to do here. And I haven't actually visited a hospital since I've been here, but I would imagine it being very similar. It's like you have to do all these, like you have to go roundabout checks and do this and do that. And like, I don't know. I feel like there'd be a lot of bureaucracy.
Yeah, the efficiency is not there.
No.
I feel like the efficiency is not there. And I remember, like, I do distinctly remember when I first, and to be fair, this was 10 years ago. But when I was studying abroad there, we had to get some kind of ID card or something that the government required us to have, you know, and they were telling us, like, they were kind of freaking us out. They were like, oh, you have to have this. Otherwise, like, you can't leave like Italy without this card, blah, blah, blah. But some people were like, it's totally fine. Anyways, we were applying for this card and we had to like jump through hoops just to get this card. I remember I had to like apply for it and then I had to like go to the post office to do something. And I also had to go to the police station to like get my fingerprints done. And it like took forever. And I remember after doing it, it took like 3 months for me to actually receive this card. Yeah. And I'm like, well, I'm only studying abroad for 6 months. So thanks for that. Like exactly. I received it like 3 months later. And I'm like, I don't understand why they were freaking us out about getting this card when it took them this long for me to actually receive it. Exactly. So anyways, I feel like there was a big, and of course, like no one's prepared for something like this. So I understand that like, it's not something that, you know, healthcare systems can deal with, but like, I think I don't know. And I think that's why Spain is also freaking out because they probably think maybe they have a similar system. I have no idea.
Yeah. This is the thing.
But people are not equipped. Like these healthcare systems are not equipped to deal with this giant surge.
Exactly. Well, I think that goes for like, I know obviously with some countries with the bureaucracy and everything else, it'll probably be a bit worse. But even in countries like, you know, Canada, the UK, even the US, I know that like from my experience in the UK and Canada, especially, like those hospitals are already like at capacity. Do you know what I mean? Like anytime you need to do anything, there's like a 4-hour wait. I mean, I don't want to knock it because we have free healthcare, which is amazing. But at the same time, like they're already at capacity with the stuff that they're dealing with. So if there's all of a sudden this like outbreak in Canada and all these people flooding to the hospitals and ERs and emergency rooms and clinics, like it would be a mess. It would be an absolute mess. So I think most countries would really struggle to deal with that kind of impactful, what is it? Epidemic?
A pandemic, apparently. Pandemic is global. I think that's what they said.
So an epidemic,
I don't know.
Like contained
it's crazy.
Within a country.
I think that's what they said, but don't quote me on that. But
yeah,
apparently they're calling it a pandemic. I know that for sure.
It's crazy. Do you want to know some interesting things that I found out about?
Okay, yes, tell me
about Corona. Just some random facts. So first of all, I guess obviously we've discussed the toilet paper shortage that this is causing, but apparently also, you know, those like face masks that people get.
Yeah.
So apparently they're causing a lot of issues there because, you know, people are buying these disposable one-use face masks and all this kind of stuff. And there's a huge shortage of face masks. And also apparently that actually the only people that should be wearing those face masks are actually the people that have the virus. This is what I've heard.
Yeah, I've heard that too.
Yeah. A funny thing though, on the World Health Organization. So I was just going through some of their like Q&A, and one of the things, it's not funny, but it was just saying, is there anything that you should not do? So it just lists 3 things that says these following measures are not effective against COVID 2019 and can be harmful. So number 1, smoking. So you shouldn't do that to try to protect against the COVID 2019. Also
to protect against it.
Yeah. I guess some people thought that
if they smoked, they would protect people themselves. Are not doing it to. Is that the list? Wait, is it the list of preventative measures?
Yeah, it's saying basically these are things that you should not do. So it's saying you should not smoke
to protect yourself.
Yeah,
but isn't it telling you just not to smoke because it's bad for you? Is people aren't smoking to try and prevent it?
I don't know. I mean, probably people that smoke are at higher risk. So.
Yeah, so I think they're just saying don't smoke because it's not a good idea to smoke because it's a respiratory disease.
But then Rose, look at the way they wrote it here. I'm going to read this to you.
Okay, read me.
Listen to this. It's actually, it's not funny.
Okay,
I need to stop laughing.
Read it to me.
But the following measures are not effective against COVID 2019 and can be harmful.
So there are.
So I think
so there are people that are like, let me kill this by smoking.
Exactly.
Essentially.
So I think that's what they mean by this. So the number 1 was.
Okay, please, guys, do not smoke to try and cure this. Yeah. It's not going to happen.
And then, if anything, after the 2 weeks is up and the world, or not the 2 weeks, but after the world has calmed down after this, you'll have a smoking habit. So that won't be great either, you know.
And smoking is the number 1 killer, I think, or whatever.
True. I think it is probably the number 1 killer.
The
second one that's not effective.
It's one of the number 1 killers.
Yeah, true.
Yeah.
The second one that they say on the World Health Organization is that this is not effective to wear multiple masks. Okay? So if you thought 1 mask wasn't good enough, 2 are not going to be effective either. Okay? So chill with the masks. And then the last.
Why are they not effective though? My question is, why are they not effective? Because to me, I would imagine it being effective.
Wearing multiple masks.
Or just wearing masks in general.
I don't know. I mean,
I don't know. Anyway, I'm not sure. I mean, if the WHO is saying it, I'll believe it.
And the WHO is saying it. I'd be on their website right now, Roses. And then the last one is, they said, I guess some people, what they've been doing to try to fight the COVID is, like they don't necessarily have it, but what they're doing is they're preemptively taking antibiotics. And they said,
oh my God, are they joking?
No, they said, don't do that either. Oh God. So people be crazy. They be smoking, wearing multiple masks, and taking antibiotics. And hoarding toilet paper.
Taking antibiotics sounds like the worst thing.
I know, it's
because doesn't that like weaken your immune system? Pretty sure it does.
I'm not really sure. And plus antibiotics, like antibodies, I thought that basically you get a prescription for antibodies based on whatever virus or whatever that you have, because then you get specific antibiotics or bodies that will fight that particular strain of the flu or whatever you have. I didn't know that, like, you could take them as a
it's
preemptive
definitely
measure.
I don't think it's a good idea to be taking them. First of all, it's not even a good idea to take them like regularly in the first place
Exactly.
because your body builds like immunities and shit.
That's right.
So your body actually gets very weak. So I know a lot of people that are constantly on antibiotics, and I'm like,
They're always sick.
you know, they're always sick,
Yeah.
and it's not a good idea. I try to avoid antibiotics as much as I possibly
Me
can.
too. But you're right.
Obviously, I'm not completely against
Exactly.
it, but
sometimes you need to take them. But
Yeah.
you're right, like because our bodies generally they have defense mechanisms, and the whole thing about the virus is our bodies they'll build an antibody or like a thing that protects us against that virus naturally. However, if we
Yeah.
if we rely on antibiotics, it won't do that, and our body won't build
Yeah.
up that immune system. So it's just
yeah.
it's not good.
Oh God. And,
damn.
another thing I was thinking about, another thing that I thought about that could be, something that maybe we should be concerned with as well is
Yeah.
people being in lockdown. It's bad for the mental health. I was like thinking about this, and I'm like,
Yeah.
Especially in a country like Italy right now where everyone is isolated, secluded. Like, I just hope that people are, doing the best they can to at least feel connected.
Yeah.
And because it is not good to be socially isolated.
No, I know exactly. They always say like those prisoners that like end up going to like isolation rooms and stuff. They end up having serious like mental problems.
Yes.
And I mean, obviously to the
So I think
lesser
this could
extent.
be, this could cause unexpected rise in, just depression or other mental issues.
There's
So
so many-
try to do your best.
Yeah, there's so many like we were saying before. There's so many. What do I want to say? Like cascading effects and impacts from
Mm-hmm.
just the coronavirus itself. And like me personally, like I'm a little bit scared of the virus, but I'm more scared of the aftermath of what's going to happen economically,
Mm-hmm.
globally. Like to see what happens in the next kind of couple months. I'm really hoping that this.
God, it feels so scary.
It does. It really does. I'm really hoping that this initial, and I could be completely wrong on this, but I'm really hoping this initial kind of panic is just the first wave of panic, and then everyone kind of calms down, it gets under control, and people kind of relax a bit more about it. I'm really hoping that it doesn't, progressively get worse, because then I would really start to get scared. Like scared of, what other people are going to do and like what's going to, happen globally. And I don't know. It's just, there's so many different factors. So I think, like you said, Rose, take care of yourself mentally. If you're in isolation, try to like reach out to people via your cell phone or
Not yet.
yeah. God damn.
I really hope that I do not get into isolation. Although I don't know, who knows.
We're not technically in
What
isolation.
was I going to say? Oh,
I was going to say,
yeah, you're not in isolation
we're
technically.
not in isolation, but we're told that we're not supposed to leave this city, like the region that we're in Spain.
Yes.
So I can still like go outside and go to the, restaurants, but I think everywhere is quite dead right now because everyone's like really, they are in a panic, except the grocery stores. Everyone's there. But we're not technically locked down yet. I could still go to other parts of Spain. I just think it's really frowned upon to travel within Europe at the moment.
Oh, 100%. And I wouldn't recommend it. I guess just moving around is not a good idea. What I was going to say was another thing that's impacted, and it's going to, probably take a hit where I live, because we've talked about it before on this podcast, but where I live, which is Alberta, Canada, Alberta is the province. We are an oil and gas province, unfortunately, and we've already been taking a big hit from, the oil and gas industry because, the oil prices have been going down in the last, few years and stuff. So, but now it's gone down even more, and now it's insane.
Yeah.
Because no one's flying, so that's going to make a huge impact in the oil and gas industry.
Yeah.
So I don't know what's going to happen here, as if we could take another hit, but
God, that's also scary on a personal level because, I'm like looking to eventually come back to Calgary, and
I know, I was thinking about that.
God, that would just suck if I can't make it back there. Well, one positive.
Well, I think you're going to have to come back regardless, because I don't know what's going to happen in Spain.
That's so true. One of the people that's on my program is from the States, and they've already booked a flight home. They were like, you know what? I'm just going to go home. Like, spend time with
Are
my
they even
family.
allowed to go back?
I don't know. They've booked their flights. So I really hope this blows over like soon. Like, I'm hoping that, because there's been this big scare now globally, there'll be like a little bit more kind of like crackdown and stuff. And hopefully with people being isolated, it will just kind of kill the virus out. The people that have it will ride it out.
Oh, God. Yeah.
And then
I
we'll
mean,
die.
to be fair, like the flu comes, there's like flu season,
Yeah.
right? So it's not like the flu just like lives for,
Ever.
right?
Well,
I think.
No, I think you can still get the flu like any time of the year, but it's more prolific in flu season.
Yes. So like yeah, exactly. You can get it at any time of year, but there's a certain times where it's like growing. So maybe this is like the COVID-19 season,
Yeah.
you know?
And then it will die off.
Oh God.
I hope.
Yeah. I mean, okay. I mean, to be fair, guys, like a lot of people have recovered.
Yeah. This is
Okay.